chemo agents. Okay, so we're back at the drawing board. And this is also one of your chapters in ATI. Chemotherapeutic agents, I believe it's like chapter 40 something. Don't remember the exact chapter. But what we're gonna do is we're just gonna say cancers, right? All cancers. Cancers. What is a treatment trial for cancers? Are you guys there? What do we treat cancer with? What is a treatment trial for cancer? Come on. I know you guys have studied. Okay, chemo. I'll put that one there. Chemo is one. What's the other one? The using of chemical agents that destroy good and bad cells. Radiation, right? Radiation. And if those two don't work, what do? If chemo and radiation doesn't work, what do? Surgery, right? Partial total and radical. What do I mean by those three things? Surgery, partial, total, and radical. What's that? Partial surgery, total surgery, radical. Anyone? Partial is going to be, Jared said, the removal of organs, okay? If we say partial, we're gonna remove part of it, right? We're not removing the whole organ. We're not removing all the tissue. We're just removing part of the organ. If we say total, we remove the whole organ. And if we say radical, again, resections, right? These are resections, partial resection, total resection, or a radical mastectomy. You heard of that? Radical mastectomy. So in total, we remove the whole organ. And in a radical mastectomy, we remove the whole breast tissue. We remove the surrounding lymph nodes. So that's what a radical mastectomy is. We don't only remove the whole tissue, but we also remove the lymph nodes that are surrounding that part. So the reason why I'm bringing this up is because the way that I teach, or the way that I want you guys to learn your categories, is for you to truly understand what are these things doing to the body, so that you can understand, once you know the whole thing, whenever you get a question about medication within that category, you're going to know what you're being asked. And I'm going to tell you right now, you're not going to remember, or you're not going to memorize all the chemotherapeutic agents, because there's so many, right? That's why there's a chapter that is just called chemotherapy agents. And it doesn't tell you, it's going to give you a whole list of different kinds. Like it says anti-metabolites, anti-tumor, antimitotics, ankulating agents, topoisomerase inhibitors, other. However, the reason why I'm putting this treatment trial is because I'm trying to form a table, just how we did it. And we're gonna delete this, so we're gonna leave here chemotherapy and radiation. So we're leaving these two because we're gonna create another table like we just did. We're gonna put it into right and left. We're gonna divide it right by the middle. And before I keep going, you guys are seeing the whiteboard, right? Yes, no, maybe. Yes, okay. Okay, we're gonna write it up here. Up. Oh, it's two. Okay, chemo agents. Desired effect action. Desired effect action. Side effects. Same as we just did. And we're gonna explore these. I'm gonna remove surgery, but now we want to know. I'm leaving radiation in there, and the reason why I'm leaving radiation in there is because when you're having radiation, all the side effects are gonna be very, very, very similar to your chemo agents. That's kind of why I brought up that triad, because the side effects are also gonna be observed during the use of chemotherapeutic agents, because we use a combination of both. We don't usually we do, but normally we don't just use chemo or just radiation. Yes, there are scenarios where they are only used, but in this situation, we're putting it there so that you don't forget that that's also being used. So what is the desired effect of chemotherapy and radiation? Why do we do these things? I mean, you're going to tell me, oh, well, it's to treat the cancer. Okay. Treat cancer, right? How? How does it treat cancer? Someone's getting technical. Inhibit. I'm going to use your words verbatim. You're getting technical. Inhibit cell reproduction cycles. Inhibit cell reproduction. What else does chemotherapy and radiation do? You got technical, but what else is the intent of using chemotherapy and radiation? We'll put here kills, and you're not telling me, kills cancer cells. Don't forget that it also kills good ones. Good cells, right? Not only cancer, but good cells. What else does chemotherapy and radiation do? Prevents metastasis. Okay, good. Prevents mets. What happens if they have a tumor? What's going on with the tumor? What's happening with that tumor? If they're on chemo radiation. Increase tumor size, right? Tumor size. So these are the kind of things that we can see, right? Cancer, it inhibits cell reproduction, it kills cancer cells, good and bad. It prevents metastasis, and then makes the tumor size small so that we can remove it, right? Okay, that's good. We're gonna leave it at that. Of course, chemotherapy and radiation do a lot more other things, but what are the side effects? What's the universal side effect of chemotherapy? What is the main thing that other cancer patients are gonna be complaining about? Nausea, vomiting. There you go. Nausea, vomiting, right? All of them. Nausea, vomiting. Nausea, vomiting. Let me highlight it. Every time that you're working with a cancer patient, your priority should be nausea, vomiting, and pain management, right? Pain. These are the two things that you want to manage. Because think about it, if you have cancer, you're already miserable, and if nobody's managing your pain, and if nobody's managing your nausea, vomiting, you're not going to be having a good time. I like this one. Immunosuppression. Somebody saying immunosuppression. Why? Why immunosuppression? Why do cancer patients get immunosuppressed on chemotherapy and radiation? Immune cells were killed. That is true. However, why do they become neutropenic? That is true. It does kill the immune cells because I told you it kills good and bad cells. But we need to narrow it down. We need to know what is being killed that is excellent, Melissa. Yes, bone marrow is being attacked. So I'm going to draw a little bone here for you to hopefully remind you, right? Maybe it drives the point home. We'll say this is a femur. And then we know it has stuff in here, right? Has stuff inside. Right? The bone marrow's in there. And then you're infusing, right? You're infusing the chemotherapy agent. And then the radiation, right? That's my radioactive stone that I have right here. And that's gonna come in here and destroy, kill all this bone marrow in here. And what does bone marrow make? What are the things that bone marrow makes? Bone marrow makes white blood cells, somebody says. So I'm gonna erase some stuff here to make space, but let's see. We're gonna move our desired effect since we already we know what we want to do, right? With chemo agents. So we're gonna delete this part. And then we're gonna put bone marrow makes bone marrow makes, somebody said, white blood cells. What else does it make? We want to give Phil Graston. Okay, what's that? What's the brand name of Phil Graston? So I see you guys are interacting with each other, so that's very nice. So we established bone marrow makes white blood cells. So it's probably useful to use chemotherapy and radiation, right, for someone that has a blood cancer that affects white blood cells, and we call that what? Okay, Neupogen is the brand name of filgrastim because it increased neutrophil count or white blood cell count. Somebody said red cells, red blood cells, I imagine. RBCs. And what else is made by the bone marrow? There's one more thing that's made by the bone marrow. So what's that disease process that I was telling you? That cancer of the white blood cells and platelets, very good. Platelets. So these are the three main things that are made by our bone marrow. Platelets, right? Platelets. Okay. So now you should start getting a picture as to what are going to be your side effects, right? So somebody said immunosuppression, platelets, and then the disease process that I'm telling you is leukemia, right? Leukemia. So now you can see why chemotherapy, radiation, and the destruction of the bone marrow is useful in treating leukemia, because if you destroy the bone marrow, you're destroying the tissue that's causing the leukemia. And therefore, how do you think we're going to treat the leukemia patients? What do they usually need to get better? What do they need after you destroy all their bone marrow? Transplant of what? Yes, it is a transplant of what? Bone marrow transplant, right? You need a bone marrow transplant to fix the leukemia. And that's how, again, radiation, chemotherapy, that's their intent is to destroy the good and the bad cells. And then in leukemia, we transplant with new bone marrow, and then hopefully that makes the bone marrow it makes the leukemia go into remission if we were successful. But again, there's very aggressive cancers that even that doesn't work, right? And then that's where the experimental treatments and all the hundreds of different chemotherapeutic agents that are being studied are going to come. So let's go back to side effects. You said immunosuppression. What's another side effect? Since you know what it's affecting and what kind of symptoms it can cause you. Let's see if you're able to put the two and two together. So if I told you the bone marrow makes white blood cells, red blood cells, and platelets, what are going to be your side effects of chemotherapeutic agents, chemo agents? Anemia, okay. Very good. Anemia, low hemoglobin, again, right? Low hematocrit. What else? Neutropenia, yeah, we kind of have immunosuppression in there. Neutropenia. What about this one? Remember? What's going on here? What is this one going to do? What happens if you affect that? Thrombocytopenia. and erythrocytopenia. That means you have pancytopenia, right? Pancytopenia, which means all, right? All. Pancytopenia. So yes, risk for bleeding. We're gonna go back. It's gonna look similar. All your side effects for anticoagulants are gonna be the side effects of thrombocytopenia, right? We don't even have to write them all down. I'm hoping if you're taking this away today, that I don't need to list all these side effects of anticoagulants and of thrombocytopenia anymore, because now you know what happens when your platelets are low. Now you know what happens when you're at risk for bleeding. So I shouldn't have to list all of that. Immunosuppression, I guess we can elaborate on that one. What happens with immunosuppression? Risk for what? Bleeding, right? Bleeding. Okay, so now you guys know what are the side effects of thrombocytopenia, and now you know infection, right? Immunosuppression is going to lead to infection. And that's why you got to do your neutropenic precautions. That's why you got to prevent the patient from catching any infections. That's why you got to do blood transfusions. And that's why they can bleed out, right? So it should all, again, be making sense. So why am I bringing this up? Is because if I go back to your ATI, I'm going to stop sharing the whiteboard, and we're going to go back to your ATI book. I was going to have some questions for you, but I don't think we're going to get to that because, I'm going over too much. I mean, maybe I'm explaining too in depth. Do you guys just want to go straight to the questions, or do you want to read some of your ATI book for chapter 30? I think it's like 42 or something like that. What do you guys think? Again, this is a review for you, whatever you think is most helpful for you. If explaining the disease process is more helpful for you, or you just want to do questions, this is your time to let me know. Questions. Okay. All right. Let's move on to the questions then. Questions. All right. Yeah, let's go to the questions. Yeah, sorry if you didn't, again, find that useful. I hope you did. I'm doing okay. You should be able to see 20 questions on your screen, or one question, and then we'll go each one. So this one's about aminoglycosides, gentamicin. Again, I know we didn't get to it, but at least I can help you with answering the question and we can talk about it. Everybody sees my screen?
Yes.
Yes, okay, perfect. All right. So it says here, a nurse is caring for a client who has E. coli and a prescription for gentamicin, 5 milligrams per kilogram per day, IV, every 8 hours. Which of the following manifestations indicate the client is experiencing gentamicin toxicity? So all aminoglycosides, gentamicin, pentamicin, tobramycin, any of those mycins are going to be autotoxic, which means toxicity where? What is autotoxicity? Ear damage, hearing damage. Hepatotoxic damage where? Liver. And nephrotoxic damage where? Kidneys, nephrons of kidneys. Very good. So therefore, you're always going to be checking for hearing loss. You're always going to be checking for liver function, and you're always going to check for kidney function. So what are the labs that will monitor liver function? ALT, AST, GGT, right? Those are a liver pan. You got to be looking in there. But not only at your liver panel, you need to be able to identify what liver failure looks like. And again, that's outside of the scope of this review, but you need to know what the signs and symptoms of liver failure are. So therefore, from what we just talked, which one of these 5 are going to be signs and symptoms of gentamicin toxicity? Tinnitus, so because we said it is autotoxic. What else? Remember that that there are balance centers in your inner ear, so you could also have dizziness. Very good. And what is serostomia? What's that? Serostomia. What's that? Dry mouth. Okay. Do you guys think that might be an answer, or we should just stick with those 2? What do you guys think? Yes, because of the kidneys. Okay. All right. Let's see what it says. Partially correct. So it says insomnia is incorrect, tinnitus is correct, dizziness is correct, and serostomia is incorrect. A client with gentamicin toxicity, I forgot about this one, is also neurotoxic. So neurotoxic, going back to the ears and the dizziness. So serostomia was actually not an answer. All right, we're gonna have A, B, C, or D question. So I'm actually gonna be able to have a poll with all of you, and you guys are gonna tell me what's the answer. So I just opened the poll. Let me know what the answer is. You can select the answer in the poll. I just launched it. Is nobody able to see the poll? It's saying poll results. Okay, let's see. Stop sharing. Relaunch poll. There we go. Okay. Sorry. All right. Try again. There you go. Awesome. Awesome. Okay, you guys are all going for B, so we'll go with B. And that is correct. We'll go to the next one. It's also a four answer question. So we're gonna relaunch the poll. And then you guys are gonna tell me which one and that. All right, and okay, you guys are answering. 5 of you are saying C. Umadin, INR 3.5. Okay, you guys are all saying C, so we'll go with C. Very good. We're gonna go to the next one. There's another one. Let's relaunch your poll. All right, go ahead. You're all saying B. Let's restart that poll again. All right, I kind of got mixed questions. Who's gonna be the tiebreaker for this one? I need one more vote. Who's gonna be the tiebreaker? So If we break it down, we use our strategies. They're having painful dermatitis from the radiation, and that's why I put radiation and chemotherapy there, because it's gonna be the same symptoms. You could have painful dermatitis with chemotherapy. You could have mucositis with chemotherapy and radiation. And then, is there such a thing as a cancer pain? What is a chronic pain, and what is an acute pain, and what is a neuropathic pain? So we need to know the differences between these things, and are they actual terminology? Acute pain, we know it's starts less than 6 months. We know that chronic pain is greater than 6 months. Again, is cancer pain really a thing? And neuropathic pain is pain from nerve damage, right? So I'm just gonna end the poll, and I'm gonna go with the answer that nobody checked, since nobody was a tiebreaker. So I'm gonna choose chronic pain, which I know is wrong. But it is cancer pain. Cancer pain is caused by a tumor or a result of cancer treatment, such as radiation therapy, surgical removal, or chemotherapy, or infection. So cancer pain is a real thing. Chronic pain is, again, longer than 6 months. Acute pain is short term. And neuropathic pain is damage to nerves. All right, let's look at the next question. Here's another one. Let's do another poll. Okay, you guys all said A. Very good. Okay, this one's on TORS, antibiotic. I guess you guys could answer this one, but it's not really about what we saw. It just got triggered because it's an antibiotic question. We'll go ahead and answer that one. Split half and half. A and D. Oh, there's a tiebreaker saying D. So remember that assault is threatening. You don't actually touch someone. False imprisonment is you detain someone without legal warrant. And negligence is you fail to act. And battery is actually doing something. For example, giving something and the patient doesn't want to. Okay, so this is acute leukemia and received aggressive chemotherapy through treatment 10 days ago. Which of the following values would you expect? So there it is, going back to what we learned, right? That chemotherapy and radiation affect the bone marrow. So just tell me 1, 2, 3, 4, or 5. Which ones of the 1, 2, 3, 4, 5? Speak up or put in the chat. Tell me 1, tell me 2, tell me 3, tell me 4, tell me 5. Somebody said 3. Somebody said 5. And what about 1? Okay, somebody said 1. Okay, 1, 3, and 5. Very good. We got it right. You guys did learn something today. Very good. Okay, we're going to open a poll again. And select one of the four. Okay, you guys all said D? That is correct, it seems. Yep, you're right. And all right, the last question for today, ampicillin, gentamicin. Who do you check for compatibility? Let me relaunch the poll. All right, I just relaunched it. Who should you check with? About medication compatibility. And then you're all set in pharmacist. Alrighty, guys. Thank you very much for attending this review session. I hope you learned something today.